oh, 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 oh. That coffee gets me right away. My name is Bob. I'm 67 years old, and I have these mystery spots all over my body. These sores are on my forehead, cheeks, stomach, right and left arm, and my legs. Fortunately, I have never had them in any of the nether regions. The first sore popped up around 2015. I fell, had an accident, broke my arm, and I had a huge infection. I fell on something that transferred to my skin. I believe that it is a live organism that travels through my body to propagate. They literally make little tunnelways. I've been to 7 skin doctors. My first dermatologist stated that I was suffering from something called parasite psychosis, which is imagining that you have something crawling underneath your skin that would cause you to scratch, itch, and possibly even cut your skin. Hearing this doctor and others that followed him say that you don't have all your marbles, that you're not all here, is very aggravating. They seem to have a preconceived notion about people who have marks on their skin, that they're doing it to themselves, but there's absolutely no way. When every single doctor that you look to help you, to save you, they refuse to do anything. It makes me lose faith in the medical industry. I don't necessarily feel hopeless, I feel helpless. So there's different strengths of home bleach and pool bleach. This one here is 8%. I normally add about a cupful. The only way it seems like I can help the pain is bleach, because it'll kill organisms, bacteria. I could lay in that bathtub for days. The problem that I have been experiencing is you can take a bath, and after, it usually gets worse. Before this accident happened, I owned my own pressure washing business, and I just loved every part of it. And because of what is happening in my skin, I was forced to go on early retirement. Lauren is my girlfriend. She is a part of my life, and she's been there for 22 years.
Well, it looks better already.
Oh, my God. I miss this so much.
I know.
If I didn't have you and other things, I don't know what I'd do.
Well, we don't do any of the things we used to do. We used to go dancing, and we don't do that anymore. I have seen so much change in Bob over the last few years. He used to be fun, and now it's a strain on our relationship.
A man is supposed to be able to make a woman feel special and provided for. This skin condition affects my relationship so much. I have not been in the same bed with Lauren in over 7 years, because if this could be contagious, I can't risk her getting this. This condition has taken away the tenderness, the intimate life, and that's more painful than these sores could ever be. The longer I go with no answers makes me very upset. I have never had any kind of mental health issue, so I hope that Dr. Lee can take an honest look at my skin and try to fill in the blanks, because I have not had anyone that's able to come up with a solution. So I just sit here and suffer. Today, I have a lot of anxiety because no skin doctor that I have gone to has been able to give me any help.
Dr. Lee will be with you in just a moment,
All
okay?
right.
Thank you.
You're welcome.
This condition has been devastating my life to the point where I just don't have any life anymore. I just would love to be able to have someone for once. So maybe I can help you.
Well, hello. How
Finally
are you
get
guys?
to meet
Oh,
Dr. Lee.
Uh-oh. How are
I've
you?
heard so much about you.
It's very nice to
Oh,
meet you, sir.
We're a bit...
Nice to meet you,
Nice
too.
to
Aren't you
meet you.
lovely? Who is this? Is this your better half?
This is my girlfriend of over 23 years.
You're Bob, okay.
Yes.
I see your arms look like they're all beat up. What's going on?
Well, I broke my arm.
Yikes.
And when they changed the bandages, the nurse that came said, you have a bad rash or an infection.
When did this happen? How long ago?
7 years ago.
7 years ago, okay.
It has spread and spread. I believe it's maybe a parasite that had gotten in there, like what dogs would get, animals would get, like a skin mite, where it
Okay.
gets into your skin, it
Well,
irritates.
you
and-
know, humans get mites, too.
Sure.
There's scabies, which is very
Sure.
specific for humans.
I've seen countless dermatologists. Everyone has told us this is an imaginary type thing. Well, it never goes away.
Okay. Bob and Lorna, they're such a sweet couple, and they've been dealing with this for a while, 7 years, dealing with a mystery condition. Sounds like other doctors have dismissed his condition, but you know, people can have parasites living on their skin, and that's part of dermatology. Let me see your arm, because usually if we look for scabies, if we look for mites, we see like burrowing. We usually look for them around the wrists, that's where they hide. Actually, the inside of your wrist is really nice and clean.
But it looks like the shapes have moved or tunneled.
Okay. Can I lift up your shirt
Sure,
and
go
see
ahead.
your back?
Go ahead.
Oh, look at how pretty your back is, though.
Oh.
That's how his skin used to be.
Your back looks really good. After taking a look at his skin, I can rule out scabies because usually you present with a rash in particular distribution. But there are some signs and symptoms that he's showing that makes me think and look in a different direction.
So what can we do to stop these things from ever showing up on my body ever again? That's what I'm saying.
Well, I get what you have is really upsetting and disturbing, but it is very hard to treat. I get what you have is really upsetting and disturbing, but it is very hard to treat. Today I'm here with Bob and his girlfriend Lorna. Bob has mysterious sores on various areas of his body, and he thinks that it's because of an accident he had on his arm 7 years ago. But you know, this story doesn't really add up to me. I'm thinking that it's something completely different. This is what I think may have happened here. You had this injury here, and it certainly probably damaged some nerves, and it doesn't feel the same when you scratch here than when you scratch other areas. You know, you could probably even rip up your skin much more and not even realize it. But also, there's a lot of stress in your life right now. And our stress manifests in our skin, actually. And the more you scratch, the more it gets itchy, the more you kind of can rip up your skin. You know, if you present with sores like this, but I don't see it on your back, that kind of gives me an indication that these sores itself are sort of created by your scratching yourself. You just can't get to that area. I know, you know, you feel that there are parasites there, but I don't really have any evidence of that.
I would love if you would just put it under a microscope to see if there's a organism that is in there. That's all
Okay.
that I want.
That's all he wants.
Yeah, because
I mean,
if you say
we can
there's
do that,
nothing,
but what if I say there's nothing there? Okay, well, let's try that then.
Okay.
Okay, you can look at it yourself and see what you think.
Dr. Lee says you're scratching it or you're itching at it, but she's going to actually take a sample and put it under a microscope.
All right, have a seat. Dr. Lee will be right with you, okay?
I hope that Dr. Lee can see what I see on my skin.
Which one do you think would be better for us to maybe see something under the microscope right away? The one on your right upper arm, that one looks fresher?
Yes, this one.
Okay, so this one here, though, we're gonna send for biopsy.
Okay.
Bob insists that he wants me to look at a skin sample right here, right now. Even though I'm not suspicious that there's a parasite here, that might be helpful for two reasons. First, taking a sample might give us a diagnosis. There are some people who know their own skin better than anybody else. And also, it will make Bob happy. He will know that we're trying to find an answer here. I'm gonna take a couple samples here. One of them I'm gonna send for a formal biopsy just to get a dermatopathologist's read on this. And the other one, I'm gonna take that piece of tissue and just put it under our microscope here. I'm gonna switch to the other side.
Just pull the cover right off. I don't need any numbing or nothing.
No! On Bob's left arm, I'm gonna take a sample, and he is so revved up, he doesn't even want me to numb him up. But of course I'm gonna do that. I am no barbarian. He has to be patient so that he's comfortable when I slice a piece of skin off. All right, I'm gonna go take a look at this.
Okay.
All right, and I'll take a little video of it, okay?
All right.
You're like my little science experiment
Yes.
today, aren't you? Now I'm gonna place the sample on a slide and go over to my microscope so I can take a good look. Okay. Hold this up here.
No other dermatologist has ever done what she's doing right now.
And I can't wait. She will see things that probably blow her away. There will be hundreds of these little parasites crawling and glisten.
Okay, so I have a little video of it.
Okay.
I mean, that's like a little hair I see. There's a little blood there, of course. There's nothing moving in there. So just a lot of...
Okay, well, what would that be right there?
Right. It could be dirt, you know, it's not like there's eyes on it, or I can't say that that is anything.
Okay.
Looking at this sample, it does not give me closure. To me, it's hard to actually discern what is in and underneath that slide. But Dr. Lee did something that no other dermatologist has ever done. So I thank her so much for that.
I'm gonna send this biopsy in. I'm gonna tell them to look at it and see if they see anything, and let's see if we can come to some more answers for you here, okay?
Okay.
Bob's convinced that he has something external that is causing these marks, but due to the appearance of the lesions and due to the distribution of them, and just my experience of treating patients for almost 2 decades, I really think he has a condition called neurotic excoriations, a condition where stress, maybe anxiety or depression, can cause you to scratch at your skin.
When am I going to be hearing from you in regards to medication or outcome or...
Well, let's find out what
prognosis?
this says first, right? This could be triggered by stress. This could even be triggered by a big surgery on his arm that caused issues here. I'm not coming to a final answer at this point. I think it's really important. I did a biopsy. We're gonna find out the results from that and see if that points us in a stronger direction. Have a safe trip back.
Yes.
Don't scratch too much,
I will
of course.
not.
I will call you. I will let you know about this, okay?
Okay, thank you.
I really want to hear from her. Hopefully, something will come about with the results that come from the biopsy. Maybe some medication that she can prescribe, or different types of treatments or techniques which will help. I can never say enough thank yous to her for her willingness to search for the answers, and I will never forget that.